You're most welcome to today's talk. It's Thursday the 13th of May. Now I'm going to start off with the UK today. Now the Scientific Advisory Group for Emergencies that advises the British government, they're having an emergency meeting as we speak now. It's about 2:30 in the afternoon now, and they're having an emergency meeting. Now this could impact the opening up things that are planned, perhaps not for the 17th of May, but for the 21st of June, the government's roadmap. Now, I'm hopeful it won't, but there is a real risk that it will. Now, we know cases are going down, we know hospitalisations are going down, but the new variant thing that we've been worried about on this channel for some time is a possible impedance in the freedom that we're hoping for from this pandemic. Now, we've been warning for months, weeks, months since the start of this pandemic. We've been warning about international travel on this channel, and for weeks, as soon as we realised there was a problem in India, we advised stopping international travel from India. But of course, it carried on for ages. Australia's the only ones that have got it right, in my view, and now we have a real risk. So unfortunately, this is where we are at. We're going to find out how big a risk this is now, I'm afraid. So there's an emergency meeting today over the rapid spread of the Indian variant. Could it affect these two times? That one will probably still go ahead. This one could be delayed now. Now, it's 45 days after it was first discovered, at least 727 officially confirmed cases. And the thing about this is it's spreading about 3 times quicker than the South Africa variant spread. So this is spreading more rapidly than previous imported variants to the UK, as this graphic here shows. So here we have numbers up here, and this is days. This is days along here, and as we see, the numbers even higher than that, 727 already by the time this graphic was made. So these are the increases in the India variant here. That one, and as we see, it's much more rapid than the South African variant, which increased much slower, and the Brazilian variant, which fortunately hasn't become a massive problem. So the Indian one is increasing more quickly, and the rate at which the pandemic has unfolded in India and Nepal is why we were so concerned about this. We realised this potential risk for some weeks now. Pity it wasn't acted on with more urgency. Bolton seems to be the epicentre. Cases doubled in the past week in Bolton. So cases overall doubled in the past week in Bolton. And this is where, coincidentally, of course it's not coincidentally, that the India variant is at its highest levels. Also in Blackburn, Bedford, South Northamptonshire, Sefton, Tynemouth, way up in the northeast, and Glasgow, also reporting cases now. Now let's look at some of the factors here. MP for Bolton, Yasmin Quareshi, ma'am, I'm sorry I've pronounced your name wrong, I don't know it. Residents have been slow to get vaccinated, so a little bit of vaccine hesitancy seems to be indicated there. Now, the REACT study, Imperial College London, infections are spreading more rapidly amongst the Asian community and in some other groups in the population, although they don't specify, as far as I'm aware, what those other groups are. Andy Burnham, who's the mayor of, is one of these elected mayors that have executive power. He's called for using vaccination as a target against spread of the new variant. So request the Joint Committee on Vaccination and Immunisations to prioritise all over 16s in Bolton and Greater Manchester area. Now, this was done in France with some success. Targeted vaccination. But of course, there's a big delay. There's at least 2 or 3 weeks, 12 days, absolute minimum, 3 weeks before you get much beneficial effect. So I can see where he's coming from. I think he's probably right, but there is going to be a delay. So to mitigate, direct quote from Andy Burnham, to mitigate the risk of spread in those communities where we are seeing more transmission. And he did say the cases are linked to international travel from Asia. Of course, as we unfortunately know already. Pity that the government weren't listening to warnings that certainly we gave on this channel some weeks before they took action. Professor James Naismith, Rosalind Franklin Institute. We should view this as a countrywide problem. So he seems to be seeing it as a more widespread problem than Andy Burnham. Localised restrictions unlikely to work. But I do kind of like the idea of targeted vaccinations, but I'm not sure it's going to happen. Maybe Sage already have that data before we continue to unlock. So do Sage know more than we do? Well, we'll hear the report from Sage, I would hope, perhaps by the time you're watching this video. As soon as we do, we'll certainly comment on it. So what strategy Sage will take there? I mean, there's already all this surge testing. It's hard to see what more they can do if they're not going to instigate more strict, localised measures. But as the what's the expression? I don't know. As the genie is already out of the bottle, that may be too late. You better do it now or you'll never do it later. We need to move from reactivity to proactivity. This is just classic, isn't it? They are reacting. The government is reacting to this situation that we proactively warned about weeks ago. It's just history repeating itself. So frustrating to watch, and I'm sure you'll share those frustrations. Now, Goa and ivermectin prophylaxis. This is a story from India. I put quite a few references there because obviously it's quite a significant change, really. So Goa are now advising ivermectin prophylaxis for those over the age of 18. Now, the idea here is that ivermectin would have an antiviral effect. If it has an antiviral effect, that's going to reduce the amount of virus in the individual, which will make them less sick, of course, assuming we accept that it has an antiviral effect. And we have looked at evidence for that in the past. But as well as that, of course, if it lowers the viral load in an individual, the individual will be shedding less virus, therefore they will be less transmissible, therefore that could stop the spread of the virus. That is the thinking in Goa. Goa, of course, is a state in India. It's on the what coast is it on? It's on the left-hand side, so it's on the west coast, just down from Maharashtra. For all those over the age of 18, irrespective of COVID-19 symptoms, so this is for the whole population, indicating how widespread the Goan state government believe the virus is in Goa. And we know it is very widespread in India at the moment, unfortunately. And they're talking about 12 milligrams of ivermectin for 5 days. Now, obviously, all the drugs mentioned here are for educational purposes only. Don't take any medicines based on anything I say in this podcast, which, of course, I have to say. So they're talking about 12 milligrams for 5 days. More on that in a minute. Anyway, State Health Minister, Goa will be the first state in the country to administer ivermectin to its adult citizens. As a step towards protecting lives, state government drugs will be given to the people through its chain of health centres. Now, Goa is a reasonably sophisticated state compared to others, some other states in India, and that they have a reasonably good, or actually fairly good, chain of health centres. So this can be, the logistics are there to distribute this to all of the adult population. Which is their plan. State government will be, so chain of health centres. Now, direct quote from the health minister. They've been studies in journals of therapeutics. So this is the direct quotes from the health minister as he gives his understanding of the situation. There have been studies in the US, UK, Japan, Germany, that when this is administered in advance as a preventative, when the entire population is administered this treatment to get the viral loads down, their mortality rate fell and effects of COVID-19 on that individual were also less. So the health minister here is clearly saying, yes, there are community epidemiological implications, but it also makes the individual less ill. And this is completely consistent, of course, with information we've looked at from Dr. Tess Lorry, from Dr. Pierre Corey and from Dr. Pravin Nair in India, who's using it routinely to prevent deterioration. And he says it definitely has beneficial effects. So lot of expertise would seem to agree with this thinking. Their mortality rates fell and the effects of COVID-19 on individual were also less. All our doctors and experts, the chief ministers, have unanimously decided to go ahead with this, so the health minister says. When I put it in italics, it's a direct quote. This is direct quote. Direct quote, we should go ahead and give it to the population. It's a must. So that was the thinking from Goa's health minister. All direct quotes. And I think you'll agree this is pretty powerful stuff. This doctor here, Goa chapter, Indian Medical Association. Now, it looks like this policy has been decided on as an emergency and it might need a bit of tweaking of the dosing regime. So the idea that you would give everyone 12 milligrams for 5 days is perhaps not as I understand it, it's not the optimum strategy. And this doctor here seems to be Goan doctor, Indian Medical Association, is looking to refine the protocol that's been suggested for Goa, and this makes sense. And I am expecting the Goa recommendations to be modified on the basis of these recommendations from the India Medical Association. I'm sure they will modify it. Anyway, treatment should not be given for a short period of 5 days. So treatment should not be given for a short period of 5 days, but should ideally be continued until the pandemic is brought under control. So again, this is consistent thinking from the India Medical Association. The ideal regime of ivermectin is to administer it on the 1st, 3rd and 7th day. So this is consistent with other things I've heard. So give a dose on the 1st day, give a dose on the 3rd day, and then perhaps weekly thereafter. But different people have slightly different views, but this is much more consistent with other views that I have read. So 1st day, 3rd day, and then perhaps weekly after that might be optimum. But of course, this is being worked out. This is somewhat new. And then continue it. I know this is exactly what they said, sorry. And then continue it once a week until the pandemic is brought under control. So the 1st day, 3rd day, once a week is this doctor speaking on behalf of the Indian Medical Association, consistent with the Goa, essentially consistent, but a modification. So giving the tablets for 5 days will not be impactful. The people weighing below 60 kilograms should be given the 12 milligram dose. So obviously this is over 18s is what he's saying. While the above 60 kilograms should be given at the 18 milligram dose, at the higher dose. And that's roughly right, because we expect about 0.2 milligrams of ivermectin per kilogram of body weight. Is sort of about the previous study we looked at in India that showed prophylactic advantage was 0.3 milligrams a kilogram, but that was just one dose for the month. This seems a more evolved strategy. As more is being learnt, the strategies are being refined. So this makes a lot more sense. And this is, of course, this is always what we do. We always give drugs on dose per kilogram of body weight. This is universal. This doctor from the India Medical Association is writing to the state health department to change proposed ivermectin dose protocol. So I would expect that to be changed. So there we go. Quite dramatic intervention there from the doctors and the health authorities in Goa. Now let's give some counter argument to this. This is from Chief Scientist, World Health Organization. Can't pronounce the name, sorry. Safety and efficacy are important when using any drug for a new indication. Yes, of course. It's an obvious statement. Then, World Health Organization recommends the use of ivermectin for COVID-19, except within clinical trials. Now, this was actually a tweet. So it looks like the World Health Organization are tweeting official communiques now, which is a rather strange way to go about things, I must say. Now, I do hope that the Goan protocols are going to be modified as per the as per the India Medical Association suggestions. And quite honestly, if the World Health Organization is wrong on this, that's finished. They're being so categorical about this that they've issued statements saying ivermectin is not efficacious, and yet there is such massive counter-argument. I mean, their credibility is questionable at the moment. They're sticking their head on the line with this. They're basically saying to go, don't use ivermectin. So the stakes really couldn't be higher for every individual in Goa and in India, but also for the international credibility of the Indian medical groupings, the government of Goa and the World Health Organization. Now, Merck, who were involved in ivermectin for many years, I think probably still produce it. I'm sure, in fact, they're sure they still produce it. Their statement, read it on their website. No scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. Now, my understanding, from what I've read, is that there is demonstrated antiviral in vitro effects. So Merck's statement here is inconsistent with my reading of the data that were presented in the past. But heck, this is Merck. These aren't small fry. This is what they're saying. Read it. No meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease is what they're saying. Well, again, let's just say inconsistent with evidence we've received from two of the world's leading clinicians on this channel, arguably three of the world's leading clinicians on this channel. So, a concerning lack of safety data in the majority of studies. Well, my understanding is this has been given to 3.7 billion people. I'm not sure I can even write 3.7 billion down. So I don't know, what is it, 3? Anyway, I can't even write it down. It's a huge number. Anyway, I could do it if I wasn't on video. I'm self-conscious. 3.7 billion people apparently have been given ivermectin. And the safety profiles are well established on 3.7 billion people. So how can they say there's a lack of safety data? Let me just say I do not understand Merck's statement here, but then again, I don't know everything. I'm intellectually challenged in many ways, and I find myself unable to comprehend Merck's statement here. Okay, you might just about leave it there for today. Maybe do one more thing. Next UK vaccination group. Appointments as of yesterday, open to 38 and 39-year-olds. Excellent. People that are 40, 41, 42, 43, 44, 45, 46, 47, 48, 49. 75% of them have been vaccinated. Excellent. Going well. Joint Committee on Vaccination and Immunisation offered Pfizer or Moderna to... now, I think this is the under... I'm going to check on that. I'm not sure about that. I'm not sure if there's under 30s or under 40s. You can tell me in the comments. But they're also offering that for pregnant women as well. And they're telling people by text message. Now, I think the safety data from this, let's just say the safety data from both vaccines is currently incomplete, and that these guidelines may change in the future. I will clarify that next time. But anyway, for sure, 75% of 40-somethings have accepted the vaccination now, and 38 and 39-year-olds can now get appointments, which is really good news. I'll just give you I've got a little bit more news. I'll just whiz through a little bit. So Nepal, quite worrying really, Nepal. 9,000 new cases per day minimum. Oxygen shortages. Now, a big part of the problem in Nepal is they get a lot of their supplies from India. And of course, India don't want to export it, understandably. But that's left Nepal somewhat in the lurch. So oxygen shortages all over the country, but just one case documented by the BBC. Lumbini province, 16 people died when oxygen ran out. Just terrible, just terrible. And this is being duplicated in other parts of Nepal and other parts of India, because India is restricting exports, which is understandable. And the cases in Nepal are, of course, massively underdiagnosed. So, again, poor people suffering greatly in Nepal. Hard to watch. Right. Europe, Hungary now vaccinating 16 to 18-year-olds from today. And this is going to be necessary. So anyone in Hungary who wants to go to a bar or music festival is going to have to give evidence of vaccination. So clearly in Hungary there's going to be some authentication necessary. Now, I got a bit confused last week. I thought the vaccination status for me, for example, or for you if you're in the UK, was on the NHS COVID app. It's not. It's a brand new NHS app. So get your phone out, go on to Play Store and download the NHS app, not the NHS COVID app. This is an additional app. It's the NHS app. And on there it tells you what medications you're on, and it's got the times and dates when you were vaccinated. So I've downloaded it, so if anyone wants to know my vaccination status with a legitimate reason to know, such as accepting me on travel or accepting me into a venue, I'm personally happy to show them that on my mobile phone. And that's going to be essential in Hungary. Germany likewise going the same way. Now, Germany, there's a high demand for the Oxford AstraZeneca vaccine as they de-restricted the age limits and are now vaccinating all age groups. So there's so much demand, appointments have had to be cancelled while supplies catch up. So good to see that vaccine demand is buoyant in Germany. Now this is the police union. Oh, that's right. So this chap, Sebastian Fielder, of the BDK, don't know what it stands for, I suspect the D's Deutschland, the police union anyway, said that forged vaccination passports are already a problem. So given that that's a problem in Germany, I expect the German authorities to address that with authenticated evidence of vaccination. That will be essential for access to particular venues, services and transport. That's the way Germany is going and the way Hungary is going, and I must say it makes sense to me. But this problem will need to be addressed, and I suspect will be addressed. Spain and Portugal, things seem to be improving. Mass sporting attendance from the 19th of May in Portugal. I think Spain's fairly similar. Regulations vary slightly between Spain and Portugal, but 30% stadium in low prevalence areas. So in other words, 100,000 seating stadium, they could have 30,000 people. Just under a third full. And Fatima, Portugal, of course, famous Catholic pilgrimage site. 7,500 pilgrims have arrived and are progressing to the Fatima shrine outdoors. And as far as I know, they're not shouting or being badly behaved. And I would see that as being completely safe because it's an organised outdoor activity. We saw yesterday that the CDC, Centres for Disease Control, stressed the importance of indoor transmission and aerosolisation. Outside, the virus is greatly diluted, and the epidemiology seems to be showing that the vast majority of cases are transmitted indoors. So these outdoor activities I would expect to be safe. So that is that's us for today. I do hope the Goan authorities are collecting good quality data on this, and definitive epidemiological evidence should come out of that, as well as I would expect massive benefit for the population in Goa. Okay, that is us for today. Thank you very much for watching.